Hello! Today we are going to be reviewing the anatomy of the male reproductive system with the terms on the board that you're responsible for knowing. So we're going to start with the scrotum. On this model, you can see the scrotum is the sac of skin that descends out of the body that contains the two testes. Now here you see it wrapped, the testes wrapped in the various layers. Here you see it with those layers removed. Inside those testes are what are known as the seminiferous tubules. Those are the twisted pathways where sperm are actually produced. And then here on top, this is called the epididymis. So if sperm are produced within the testes, they're then pushed into the epididymis, where they stay for a while until called upon. Attached to the epididymis, you then have this passageway, you can see it best here, called the vas deferens. The vas deferens is what carries the sperm up into the pelvic cavity. Notice how it comes above the pubic bone and then heads back to behind the bladder. And then it runs into this gland right here called the seminal vesicle. Now there's one on either side. So two testes, two vas deferens, and they run into two seminal vesicles. Now I'm going to open this model up so you can see what's going on from there. From that seminal vesicle, the contents then go through this ejaculatory duct here into this small gland, about walnut size, wrapped around the urethra. That is called the prostate gland. That short passageway from the seminal vesicle through the prostate gland is called the ejaculatory duct. At that point, all the contents, so the sperm plus the liquid contents from the prostate and from the seminal vesicles, are all dumped into this passageway here called the urethra. And you remember the urethra, which drains the bladder as part of the urinary system. Well, now it comes into play in the reproductive system. This urethra runs down the entire length of the penis. But there's also a set of glands, they're not very well seen here, but a little set of glands here that are emptying into the urethra as well. Those are called the bulbourethral gland. Very small, they're a pair. Their contents are put onto the urethra to clean it in preparation for the semen that will eventually go through. Because it's a shared passageway of both urine and semen, we need to have a cleaning mechanism there. All right, and then of course the last structure is the penis. The shaft of the penis, the head of the penis, widening out there. And then for those who are uncircumcised, this flap of skin covers the head of the penis. It's called the prepuce or foreskin. In a medical or religious procedure called circumcision, that is removed. So make sure you're familiar with all of these terms, and